Good day. Bukhara State Medical Institute after Abu Ali Ibn Sina, Department of Faculty and Hospital Therapy, Doctor of Medical Science, Mahmoudova Lola Izatulayevna. Today's lecture theme of atypical time forms of myocardial infarction. Myocardial infarction is necrosis of the heart muscle as a result of an acute and pronounced imbalance between myocardial oxygen demand and its delivery. Risk factors for developing myocardial infarction. It's age, men over 14 and women after 50 years of age or with early menopause. Angina pectoris, heart attack or sudden death in blood relatives. In men under the age of 55, in women up to 65 years. Smoking, including passive smoking, long-term and frequent presence non-smokers present in a smoky room. Obesity, physical inactivity, hypertension, hypercholesteremia, myocardial infarction postulated in the past, and comorbidity. Clinical forms of myocardial infarction. The first, it's typical forms, anginal, painful forms. And the second times, it's atypical forms. It's abdominal gastralgic forms, arrhythmic forms, asthmatic forms, cerebral forms, and painless, asymptomatic or erased forms. Same, the large local, large focal, small focal, indicating the affected area, anterior, lateral, posterior wall of the left ventricle. And depths of cardiac muscle necrosis, transmural, maybe intramural, subendocardial, and subepicardial types of myocardial infarction. Etiology and pathogenesis of myocardial infarction, occlusions, thrombosis, embolus, atherosclerotic plaque of the coronary arteries, acute discrepancy between the volume of blood supplied through the coronary vessels, pathological altered myocardial requirement for oxygen and nutrients. 90% cessation of blood flow to the side of the heart muscle through the coronary arteries sharply altered by atherosclerosis. Typical angina, it's the first form of myocardial infarction. Pain behind the sternum radiating to the left arm, shoulders through between the shoulder blades, lower jaw. By its nature, the pain is burning, constricting, pressing. The duration is more than 30 minutes. The pain is not relieved by nitroglycerin. The pain is not associated with breathing and tongue movements. The pain is relieved by narcotic analgesics. Feeling of fear, fear of death, anxiety, cold sweat, pallor, decreased blood pressure, hyperemia, increased blood pressure, deaf heart sounds, pathological murmurs, and arrhythmias. The most acute period, it's the first period of myocardial infarction, the time between the onset of sharp ischemia and the appearance of necrosis of the area of the heart muscle. Duration of 30 minutes to 2 hours with resorption of a blood clot, reverse developments is possible. Characteristic status anginosis, an increase in blood pressure is in the first hours, then a decrease. manifestations of not only vascular but also heart failure due to a reduced contractile function of the left ventricle. The most acute period of myocardial infarction, tachycardia, and other heart rhythm disorders may be gallop rhythms. Acute period of myocardial infarction, the time of the formation of the site of necrosis and myomalacia from 2 hours, 10 days duration. Pain disappears. Preservation is associated with the severity of the peri-infarction zone or with epinecrotitis pericarditis, increased hypotension and heart failure, maybe fever. And neutrophilic leukocytosis or hyperleukocytosis, increased ESR, increased activity of blood enzyme, creatine phosphokinase, AST, ALT to a lesser extent, hyperglycemia, decreased albumin, increased globulins, and fibrinogen. The emergence of C-reactive protein. ECG signs, monophasis curve, characteristic segment change ST, PRONCH T and R. In almost all patients, rhythm and conduction disturbance during monitoring. Tachycardia, low sonatory tones, gallop rhythm, systolic murmur at the apex and at the fifth point, pericardial friction, noise with pericarditis. Subacute period of myocardial infarction. Completion of the initial process of scar organization. Necrotic masses are replaced by granulation tissue. For 8 weeks from the onset of the disease. Prognostically favorable, no pain, reduction or persistence of manifestation of heart failure, and health rising but does not reach the previous level. And in 30–40% of patients, rhythm disturbance, disappearance of tachycardia, sometimes systolic murmur, disappearing resortively necrotic syndrome, decrease in leukocytosis or normalization of the indicator, the disappearance of the PI shift, the appearance of eosinophils. Normalization of blood sugar, CPK, ALT, AST, the ratio of protein fraction may remain impaired, and ECG dynamics. Post-infarction period. The time of the increase in scar density, the maximum possible adaptation of the myocardium to the new condition of the functioning of the CVC. Maybe Dressler syndrome, rhythm disturbance, and chronic heart failure. ECG signs of a formed scar. Some increase in ESR, a shift in the ratio of protein fraction of blood. It's a typical form of myocardial infarction. Abdominal forms, it's arrhythmic forms, cerebral forms, and also cerebral forms. Abdominal form, intense pain, epigastric tumor in the area of the right hypochondrium, the right half of the abdomen. Irradiation of pain is absent or is observed in the back shoulder blades. Manifestation of dyspeptic syndrome, vomiting, nausea, possibility diarrhea. At palpation of the abdomen is noted moderate stress and soreness of the abdominal wall, cold sweat, pallor, decrease in blood pressure. Arrhythmic forms, palpitation, interruption in the work of the heart, sinking of the heart. The ECG show various disturbances in rhythms and conduction. Pain are absent or do not attract the attention of the patient. Simultaneously, development of severe weakness is possible. Asthmatic form, dyspnea at rest, choking, cough with front-peak phlegm, position orthopnea, palpitations. The pain components is little or absent, sharp pallor and moisture of the skin combined with cyanosis of the nasolabial triangle. Gallop rhythms, wet wheezing, arrhythmias, maybe decrease in blood pressure. And cerebral form, dizziness, disorientation, fainting, nose in airs, nausea and vomiting. Focal neurological symptoms, transient weakness in limbs and dysarthria and others. Painless form of myocardial infarction, weakness, sweating, and uncertain pains in the chest, the discomfort may be, shortness of breath, interruption in the work of the heart. Diagnosis of myocardial infarction, typical chest pain lasting more than 30 minutes, not stopping, repeated intake of nitroglycerin. In atypical form of the diseases, the equivalent of pain syndrome may be atypical localization of pain, shortness of breath, and others. Typical change to ECG, segment change ST, as well as T wave, or the appearance of PBL, PNG, and abdominal Q wave. Laboratory diagnostics of markers of myocardial necrosis, troponin test, CPK, NCF fraction of CPK, and myoglobulin. ECG diagnostics for myocardial infarction, it's 4 phase, 0 phase, peaking T positive, high white. Fast first, Q small, R small, monophasic ST elevation and T positive. Fast second, Q large, R small, ST elevation regressing, T peaked negative. Fast third, Q large, R higher, S in fast second, and ST elevation vanished. And fast fourth, Q still large, R normal dimension again, no ST elevation, no ST decline, and T positive again. Dynamics of ECG change. The first ECG, it's normal ECG. The second, acute phase of myocardial infarction after hours, after 1-2 days, after days later, and after weeks. Activity, creatinine, phosphokinase, CPK usually rises after 8-10 hours from the onset of myocardial infarction and returns to normal after 48 hours. Determination of activity is carried after every 6-8 hours. At least 3 negative results are required to rule out myocardial infarction. The most information for myocardial infarction is troponin test, TP. Lactate dehydrogenase, LDH, becomes higher on the third and fifth days of myocardial infarction. Troponin test. Troponin is a protein that is one of the components of the contractile apparatus striated muscle, which allows actin and myosin muscle fibers to slide relative to each other. Troponin, a myocardial infarction test, makes it possible to make a diagnosis within an hour after it is carried out. Troponin test. Acute myocardial infarction is excluded if it's 0.4 mg low from it. Infarction is not ruled out, or myocardial diseases from 0.4 to 203, and myocardial infarction high 2.3 mg. The emergency troponins in the bloodstream does not occur immediately after the onset of the disease, but after 6 hours. This indicates that the study should be organized no earlier than 4 hours later. By using troponin tests, you can make a differential diagnosis between heart attack and angina pectoris. An increased level of this protein is observed within 2 weeks. EchoCG, it is performed with prolonged pain syndrome and the absence of typical ECG changes. Local contractile disorders indicate ischemia or myocardial infarction. Thinking of the wall of the left ventricle indicates a previous myocardial infarction. With good visualization, normal left ventricle contractile almost excludes myocardial infarction. Emergency coronary angiography. It's carried out in the presence of risk factors for coronary artery diseases and protracted pain syndrome, when ECG changes do not give complete confidence in the diagnosis. Emergency care for acute myocardial infarction. Its first ECG, acetylsalicylic acid 250 from 250 to 350 mg orally. Nitroglycerin or isosorbate dinitrate spray 1-2 doses. Morphine up to 10 mg. Clopidogrel 600 mg or ticagrelor 180 mg oral during transport for emergency. It is impossible to hospitalize the patient for emergency PCI with 90 minutes. It is indicated thrombolytic therapy. Clopidogrel 300 mg orally for patient over 65 years old, 65 mg. Heparin 60 and maximum to 4,000. And then fifth acute period is spent coronary angiography, detect an infarction-dependent artery and stent it or at least temporarily expanded with a special balloon. This procedure is called salutary percutaneous coronary intervention, since it is carried out immediately upon admission of the patient to a medical institution without waiting for the effect of therapy or when other methods have already been exhausted. Complication of the myocardial infarction. The first period, it's heart rhythm disturbance, acute left ventricle failure, cardiogenic shock, it's reflex, arrhythmic, and true. Maybe And the second period complication, it's pericarditis or Dressler syndrome, parietal thromboendocarditis. And post-infarction period, chronic aneurysm, autoimmune syndrome Dressler, post-infarction cardiosclerosis, and chronic cardiac failure, heart failure. Thank you for attention.